Welcome to the Introduction to the Heart Health Intervention Program. The program goals include to create a program that is accessible and effective at reducing risk of heart disease. Also to improve the weight, blood pressure, cholesterol, blood glucose, and/or knowledge about heart health in participating members. We also want to improve community well-being through promoting healthy lifestyles, group support, and self-confidence to improving heart health. In this program, you will have your heart disease risk screening, which includes heart rate, BMI, blood glucose, etc. Then you will take our initial assessment for heart disease risk. Then you will follow our informational website video program based on your results. There will be weekly meetings with your group for discussion and progress updates. Then we will reassess your health through screening and habit changes. The heart health screening includes tests that measure heart rate, blood pressure, weight/BMI, cholesterol, and blood glucose. All of these factors are very important in determining your heart disease risk, and we will be measuring these at the beginning and end of the program. The online website learning program is our tool that we will use to educate you on factors that affect heart health and ways to reduce your risk. Video topics include heart disease risk in relation to blood pressure, heart rate, lipid profile, and BMI, as well as obesity, smoking, blood pressure, diabetes, diet and exercise, and more. Our weekly meetings will consist of group lessons with your community leader. As a group, you will watch the videos and presentations about heart health and discuss them. There will be weekly assignments and goal setting. The group discussions may be about everyone's progress updates, feelings about the program, or discussion on what was learned through the website. In our final assessment of the program, we will do a heart health screening to see if there was improvement. Then, you as individuals will create a future plan to continue living a heart-healthy lifestyle. Then we have a post survey to assess the effectiveness of our program. Now we're going to talk about signs and symptoms of heart disease as part of the Heart Health Intervention Program. Why is it important to know about heart attacks? Every 34 seconds, someone dies from heart and blood vessel diseases. It is America's #1 killer, with over 375,000 cases each year. It is important to learn all you can about heart attacks to reduce people's risk of a fatal heart attack. What is a heart attack? A heart attack occurs when the blood flow to a part of the heart is blocked, often by a blood clot. This happens because coronary arteries that supply the heart with blood slowly become thicker and harder from buildup of fat, cholesterol, and other substances called plaque. If the plaque breaks open and a blood clot forms that blocks the blood flow, a heart attack occurs. Then the heart muscle supplied by that artery begins to die. Damage increases the longer an artery stays blocked. Once that muscle dies, the result is permanent damage. What is a stroke? A stroke happens when a blood vessel that feeds the brain gets blocked, an ischemic stroke, or burst, a hemorrhagic stroke. Then that part of the brain can't work, and neither can the part of the body it controls. TIAs, or transient ischemic attacks, are warning strokes that can happen before a major stroke. They happen when a blood clot clogs an artery for a short time. The signs of a TIA are like a stroke, but they usually only last a few minutes. If you have any of these signs, get to the hospital right away. Uncontrolled high blood pressure, high cholesterol, smoking, and heart disease put you at a higher risk for stroke. General signs of heart disease include fluttering or pounding heartbeat in your chest, swelling of the extremities, shortness of breath, lightheadedness or dizziness, chest pain or pressure, especially during exercise or when stressed, and pain in the neck, jaw, throat, upper abdomen, or back. If you have any of these symptoms, you may need to see your doctor to see if you have any heart complications. Heart failure is when your heart works, but it does not pump enough blood to your body, so your body isn't getting enough food or oxygen. Edema is when fluid builds up in your body, causing swelling in your feet, ankles, and legs, and can be caused by heart failure. Heart failure can also later cause pulmonary edema, which is when fluid builds up in your lungs, and can be fatal. Heart failure can get worse if it's not treated. It affects 5.7 million Americans, and it's the main reason people age 65 and older go to the hospital. Signs that a heart attack is happening include uncomfortable pressure, squeezing, fullness or pain in the center of your chest. It lasts more than a few minutes or goes away and comes back. You can also have pain or discomfort in one or both of your arms, your back, neck, jaw, or stomach. You can also have shortness of breath with or without the chest discomfort. Other signs include cold sweating, nausea, or lightheadedness. Signs of a stroke happening include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. You can also have sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, or sudden severe headache with no known cause. If you see any of these signs of a stroke, you need to act fast. Fast is an easy way to remember how to recognize a stroke and what to do. Stroke symptoms include face drooping, arm weakness, and speech difficulty. If you see any of these symptoms, it's time to call 911. Also remember to check the time when you saw the first symptoms appear. This is important because a certain medication that can help the stroke needs to be given in a certain amount of time, and knowing the time when the stroke started can tell if this medication can be given or not.